I didn't think my first morning at Jefferson Memorial would start with someone calling security on me. But then again, I should have known better. I've been in medicine long enough to recognize the expression, the tight-lipped smile, the narrowed eyes scanning my ID badge like it was fake, and that smug little head tilt that says you don't belong here. But I'll be polite enough to not say it out loud. It was 6:45 a.m., and I was trying to make my way through the back corridor to the cardiac wing, stethoscope around my neck, badge clipped to my coat, ready to begin the quiet shadow phase before I officially stepped into my role as chief of cardiothoracic surgery on Monday. But before I even reached the scrub station, a nurse I'd never met, blonde ponytail, crisp scrubs, clipped voice, blocked my path with a clipboard and narrowed eyes. "Can I help you?" she asked, in that condescending tone that doesn't actually want to help. "I'm Dr. Mira Nair," I told her, gently, clearly. Just getting a look at the layout before shift changes. Her eyes dropped to my badge again, and then flicked to my face, like she was trying to decode a puzzle she didn't quite believe. "Are you even allowed back here?" she asked, loud enough that a nearby resident turned to look. If you've ever been underestimated just because of how you look, if you've ever had your intelligence, your presence, or even your humanity questioned by someone who thinks they're better than you, like and subscribe. I still feel it in my chest. The hallway fell awkwardly silent. I felt a wave of heat rise to my cheeks, not from shame, but from the sheer absurdity of it. I could have pulled rank right then. I could have said, "Actually, I'll be your boss in 3 days," or, "I've performed more thoracotomies than anyone in this building." But I didn't, because part of me wanted to see how deep this would go, how far she'd dig herself. Her name tag read Lindsay, and she gave me a tight smile like she was indulging me. "You'll need to wait in the lobby," she said, before turning to the security guard she'd already flagged with a glance. "We've had people sneak in before, saying they're doctors." The guard, a tall white man with tired eyes, looked at me like I was holding something dangerous. I showed him my ID again. I explained again. He didn't apologize, just muttered, "You can't be too careful these days," and stood there like a bouncer outside a nightclub. Meanwhile, a white male resident, probably half my age, sauntered through the same hallway without so much as a nod from Lindsay. He wasn't even wearing a badge. I made eye contact with him. He looked away. I stayed silent. This wasn't new to me. I've been mistaken for everything but a surgeon since my 3rd year of med school. Patients assuming I was the nurse. Admins asking if I was in the wrong meeting. Colleagues double-checking my math or calling me sweetheart during rounds. And every time, I had to choose. Do I correct them and look angry? Or swallow it and stay graceful? Back then, I used to try and perfect my accent, sanding down the soft consonants of my Carolyn English so I wouldn't be asked, "Where are you really from?" in front of an or team. But it never mattered. It wasn't about how I spoke. It was about who they thought had the right to speak with authority. And in Lindsay's eyes, I didn't. I watched as she returned to the nurse's station, laughing under her breath with another nurse who glanced at me, then turned away. It was like I'd become invisible and hypervisible at the same time. Not worth listening to, but worthy of surveillance. Eventually, I left, not because I was afraid, but because I had already seen everything I needed to see. I walked out of that corridor with every word, every sideways glance, every moment of subtle exclusion folded neatly into the mental ledger I've carried since my residency. People assume racism in medicine is all slurs and denied promotions. But it's often more insidious. The eye roll when you speak, the disbelief when you introduce yourself as doctor, the way people pretend not to hear you when you point out a mistake, until someone white repeats it. That morning, I went to the coffee kiosk outside the hospital. The barista, a young black woman with a nose ring and a big smile, handed me my espresso with a wink. "You one of the smart ones, huh?" she said, eyeing my coat. "They're gonna have to get used to you." I smiled back, but I didn't say what I was thinking. They'll have no choice. Because I wasn't just visiting. I wasn't rotating in for a few weeks or covering someone else's shift. I was here to lead. And when I stepped into that role on Monday, every person who had looked through me, laughed at my pronunciation, or questioned my badge would have to reconcile one undeniable truth. I belonged. Not because I had fought twice as hard to be here, though I had, but because I earned it. Every stitch, every scar, every saved life. And I wasn't going anywhere. Over the next 3 days, I moved through the ER like a ghost with a clipboard, watching, listening, remembering. Technically, I was shadowing, but I was also studying something else entirely, not just the medical protocols, but the culture, who got listened to, who got sidelined, who got believed. I saw how easily bias slipped into every corner of that hospital, not just in what people said, but in what they didn't say. I watched Lindsay dismiss a Latino nurse's suggestion about a dosage because he should probably double-check with a real doctor. I watched her roll her eyes at a black patient who said her chest pain was an 8 out of 10 and whisper to another nurse, "She's probably exaggerating for meds." But it wasn't just her. It was the way people co-signed it with silence. The way the ER techs laughed when Lindsay mimicked a foreign accent behind a closed curtain. The way a senior physician said, "Mira, it's so refreshing to see a woman in your position," and then immediately followed it with, "Do you ever miss home?" Or curry, as if my whole identity boiled down to spice and nostalgia. And still, I didn't say who I was. I kept my title tucked away like a scalpel I wasn't ready to use yet, because I needed to see the whole picture, unfiltered, unguarded, real. And every day, I added more to the list. Every shrug, every joke, every time someone introduced me as Mira instead of Dr. Nair, while calling the male residents doctor, without hesitation. I wasn't surprised. Just tired. Tired in that deep, bone-heavy way that comes from decades of being gracious under pressure. From always having to laugh off the question of how your English is so good, or why you didn't go into pediatrics like the other Indian ladies. From walking into interviews where they praised my resume but asked if I could connect with patients in America. I remember one attending in med school who told me I'd be more palatable if I wore smaller earrings and didn't bring Indian snacks that smelled like something exploded. I spent my 20s trying to become palatable. Smaller, softer, straighter spoken. But eventually, I realized they'd still see what they wanted. Someone who looked like she belonged in the supply closet, not in charge of the operating room. So now, I don't shrink. I just watch and wait. Like I did that Wednesday, when a code blue was called for a patient in respiratory distress. I followed the team into the room because I'm a surgeon, because I knew what to do. And as I started reviewing the chart and offering suggestions, Lindsay cut across the chaos with a pointed, "We don't need input from observers right now." She didn't say you're not qualified. She didn't say you're wrong. She said, "Observer." Like I was furniture. Like I wasn't worth hearing. I locked eyes with the respiratory therapist across the bed, an older black man named Curtis. He didn't say anything in that moment, but he saw it. That mattered. Later that day, I found Lindsay making small talk with a group of interns by the vending machine. She didn't see me approach, and I overheard her say, "I don't care what her badge says, she sounds like she's faking it." Like she watched too many seasons of Grey's Anatomy and learned the words without understanding them. One of the interns laughed. Another said nothing and quietly walked away when he saw me standing nearby. Lindsay turned and froze. For a beat, we just stood there in the sterile hallway, surrounded by humming machines and flickering fluorescent lights. I gave her the same tight smile she had given me 3 days ago. "Everything all right?" I asked, calmly. She cleared her throat and muttered something about a caffeine crash before disappearing down the hall. I didn't chase her. I didn't need to. Because justice doesn't always come like a hammer, it can come like a sunrise, slow and unstoppable. That night, I called my husband and told him I was ready. "You sure you want to wait until Monday?" he asked. I'd have gone full Bollywood already. I laughed, really laughed, for the first time that week. "Let them enjoy their last 3 days of comfort," I said. "After that, we get to work." But even in those final days, it got harder. Harder to bite my tongue when another nurse repeated a treatment plan I'd already suggested, louder and with more confidence, and suddenly it was brilliant. Harder to stay composed when a patient's daughter looked me up and down and said, "I asked for the real doctor," and Lindsay didn't correct her. Harder to carry the weight of being every first Indian woman in that department, first person of color to lead cardiac surgery at Jefferson. First one to openly push back against the culture of silent supremacy that had wrapped itself in politeness and policy for decades. But I carried it anyway, because the weight of silence was heavier. And I wasn't alone. Curtis gave me a nod every time we crossed paths. The Latino nurse, his name was Marco, started taking lunch breaks with me and casually mentioned how he'd filed a complaint about Lindsay last year. But nothing stuck. The barista downstairs started putting a little hard on my cup. And slowly, I realized, even in this place built on arrogance and assumption, there were people waiting for someone to crack the ceiling. And I would. Not with a scream, but with a calm, unwavering voice that they couldn't ignore anymore. A voice they tried to mock, flatten, ignore. A voice that was about to speak through the loudspeaker of leadership. I wasn't coming to burn the place down. I was coming to rebuild it, brick by brick, truth by truth. And the first brick would drop Monday morning. Monday came like a calm after a long storm, not with fireworks, but with purpose. I arrived earlier than anyone, changed into fresh scrubs, pinned my full title badge to my chest, and walked into the staff breakfast like I was stepping onto an operating table. Measured, steady, unshakable. Lindsay was there, of course, laughing with the same interns, tossing glances toward the door as if waiting for the new chief to arrive so she could make her move. She didn't even glance at me when I walked in. Not until the medical director stood at the podium and tapped the mic. Everyone, I'm honored to officially introduce Dr. Mira Nair, our new chief of cardiothoracic surgery. The moment Lindsay turned and realized who I was, her face did something I'll never forget. Collapsed inwards, like every smug assumption she ever made crumbled in one breath. I stepped forward, took the mic, and for a long second, just looked out across the room. My voice didn't tremble. In my first week here, I was mistaken for everything but what I am, I said. An observer. A trespasser. A foreigner. A few heads turned. Lindsay paled. This isn't unique to me. This happens every day to people who don't fit someone else's idea of what a leader, or a surgeon, or even a human being is supposed to look like. The silence was heavy now, and I let it hang. Bias, when left unspoken, doesn't stay harmless. It becomes policy, it becomes culture, and it becomes danger. I didn't name her. I didn't have to. Afterward, people approached me, some with congratulations, some with apologies wrapped in small talk. Lindsay didn't say a word, but I saw her hesitate before walking away, like she suddenly wasn't sure how to move through this place anymore. And that was enough. The hospital quietly reassigned her to a non-patient-facing role. Meanwhile, I set up monthly bias training in my department, established an anonymous incident reporting system, and personally invited Marco and Curtis onto a diversity council that now helps shape hiring and culture at Jefferson. But most of all, I stayed visible, present, unapologetic. And every time someone stumbled on my name, I said it louder. Every time someone mocked an accent in the break room, I stood next to the person being mocked. Because change isn't always explosive. Sometimes, it's the presence they can't erase, the voice they can't talk over, the title they now have to say with respect. My name is Dr. Mira Nair, and I believe they know it now.